Hello, everyone. It's another day with your fertility specialist. On behalf of Alps Hospitals, I welcome you all to an exciting session with us on a day with your fertility specialist. I want to say thank you, dear viewers, for always staying glued to your screen. Thank you for always liking our post. Thank you for sharing. Even as we're starting, please share this link with someone, call up someone. If you need to send data to someone, please do that right now. So we could have a good time together. And as a matter of fact, it might interest you to know. I'm sure that for those of us that have seen our flyer, you'll see a face you're not familiar with. So, yes, we have a special guest with us today in person of Dr. Samuelson. Dr. Samuelson, you're welcome.
Thank you very much.
It's
Good
good
to
to
be here.
have you with us.
Thank you.
Yes, so viewers, a little bit about Dr. Samuelson. He's a consultant gynecologist that has experience with women reproductive health, pregnancy care, infertility management, and minimal invasive procedures. So it means he's also a minimal access surgeon. He's also a fertility specialist, has so much passion in the care of patients, clinical expertise. You cannot fault him on that. So you see that we have an excellent personnel with us today. He's a gynecologist per excellence. It's good to have you with us, Dr. Samuel Sim.
Thank you for that kind introduction.
Oh, yeah. So, viewers, today we'll be talking about maternal age and all that it entails. What happens with advanced maternal age? What's maternal age all about? This whole thing that we talk about age and women, and in fact women never like to get old because of the way we always, we just always want to remain in our 20s or early 30s. Well, so let's talk about the concern about maternal age today. So, well, maybe would start with, first of all, I would like to say, viewers, if you have your questions, your concerns, your opinions, please feel free to drop your comments in the comment section, ask your questions. Like I mentioned, we have a very, very excellent personnel with us today. So you know that whatever information you're getting today, you can count on them. Yes. So please drop your thoughts, your concern, whatever it is that might have been bothering you that you've actually not gained clarity on. Please feel free to drop those questions and we'll definitely respond to them. So Dr. Samuelson, yeah, it's good to have you with us, I must say.
Thank you, Ruth.
Yeah. So we have advanced maternal age. Well, what when you say advanced maternal age, with respect to gynecology, I mean the general gynecology, what does advanced maternal age refer to?
The terminology of advanced maternal age is worrying, isn't it?
It is. It is.
Uh, I can imagine.
Maybe we should also invent advanced maternal age.
But technically, there is something like that, even though
Well,
diagnostically I've not seen it.
yeah.
Yeah, so I can imagine a 35-year-old woman you're telling her it's advanced,
Oh, yeah. Advanced.
age.
Yeah.
But technically speaking or medically speaking, when we talk about advanced maternal age, we mean that a woman has gotten to an age where the possibility or the chances, let me use the word chances of conceiving begins to decline. Yeah, and so that's why we use the term advanced maternal age.
Okay.
Yes, and also it's also a term that is also used in obstetrics. In a pregnant woman that has reached an age of 35 at the day she's going to deliver, and because we use that to explain when a woman has an increased risk of maybe having medical conditions in pregnancy, having maybe pregnancy losses and all that. So that's why we use the term advanced maternal age. So technically speaking, the that term is used only in the context of fertility
Okay.
or pregnancy. Yes. So
Okay. So viewers, hope we're noting that. So it means that yes, as a woman, once you're over 35, so when you hear some of the doctors saying she's elderly primary, you can relate. We'll
yeah,
feel elderly 50, 60, and then you now see maybe somebody 39, 40 days elderly primary. Well, that's he has just made us understand why it's that way. And Mel, as we go on, we can also understand some of the things that are peculiar with this advanced stage, and that's why more attention will be drawn to it once they are tagged in that advanced
yeah,
maternal age. Well, many women today have actually become mothers. We have in our society today, we have women that tend to get married towards this age. With respect to reproductive medicine, how have you embraced this reality? Because a lot of women now come in, they are in their 30s, mid 30s, or even late 30s. For instance, even for basic antenatal, and you're asking first pregnancy, they say
yeah.
yes, first pregnancy. So how have you adjusted or adapted to? What have you done with respect to this new world? Because before you will see people 18 years,
Yeah.
19 years,
Mhm.
first time mom. You are seeing a 39-year-old man, she's saying, I'm
Mhm.
a first time mom, or is even that time maybe they are trying to seek help at that age. So,
Yeah.
well, with respect to this, how is reproductive medicine actually coming to terms with this?
Yes. Well, so once a woman gets to the age of 35 and above,
Yeah.
and she's concerned about fertility, or she's coming to the doctor seeking for fertility, we tag that age and above as advanced, right? And like you said, many women, because of the culture and the environment and the improvement in lifestyle, technology, and everything, most women are putting off having kids to much later in life, right? So
Yeah.
because they want to pursue a career, they want to get educated, they want to make some money, have their own
Mm,
personality, and nothing is wrong with that, really. The only concern we have as gynecologists and
yeah.
fertility doctors is
Mm,
that the longer you put off your desire to have children, then the more difficult it can get.
mm,
Now, this is not to say that any woman that is 35 years and above cannot conceive. That's not what the term means.
yeah.
There are many women that still have their children in their late 30s, in their early 40s. I've seen that, right?
Mhm.
Yeah, but once you get to that age, that the chances of conceiving, by reason of
Yeah.
studies that have been done, and it has been scientifically proven by these studies, that once a woman gets to 35, the possibility of her conceiving begins to drop, right? And by the time she gets to 40, it drops even more. Okay. So for us as gynecologists and fertility doctors,
Yeah.
we are beginning to take those things. The science has evolved over time to take those things into cognizance or into consideration while dealing with. We has involved, improved to be able to
Yeah.
also
Mm-hmm.
find a solution for those kind of
Women.
category of patients
Mm-hmm.
if
Mm-hmm.
and when they are ready to have their kids. Yeah.
Okay, so yes, viewers, I would still want to emphasize that if you have your opinions and your questions, please, I would anticipate them, because this is really something that is burdensome, that we think we need to talk about. A lot of women, we are getting to this age, so I and then nothing has been done previously. That's why a lot of awareness is being created now with respect to a woman planning to freeze her eggs. So later in life, when she's ready, they will not start saying, you don't have eggs anymore. We're not talking about donor eggs. Should it be that conception becomes a problem? Well, as we go on, we would see some of the modalities that have actually come into play to be able to help such women. But for now, let's check this. So, are there some fertility challenges that are actually peculiar with women from this age and above? Well, like, what are some of the possible challenges that they could do with, even maybe in the course of pregnancy or even while trying to conceive? What are some of the possible challenges that might be facing with these women that are in this range of advanced age?
Hmm. Well, um, there are quite a number of things and
Hmm.
challenges that women can face with regards to pregnancy and fertility
Yeah.
the older they get. First, we could talk about even the the ability to conceive, right? Because and the ability or the chances of conceiving reduces, and this is really has to do with what is going on in the ovary of the woman, right? Because the older she gets, the more the ovarian reserve drops, the number of
Right.
eggs she has available to become a baby drops,
Yes.
right? And then not only does the quantity of the eggs drop, the quality also of the eggs also drop, because quantity of the egg, yeah. So the quantity problem, but that could be wrong. Um, in that age group, for instance, I could list a few things. For instance, even talking about medically, generally, the older a
Yeah.
person gets, the more the person is predisposed to chronic diseases, diabetes,
Yeah.
hypertension, cancers. Those things can occur, and those things can also affect the woman's ability to get pregnant. Now, if also a woman has not gotten pregnant and she's getting a bit older, we can have uterine factors, like she could develop fibroids. You understand? And by the time fibroids take over the uterus,
Uterus,
it may become
yes.
a little bit more difficult to conceive. And there are other biological or psychosocial things, like even libido drops. As a woman gets older, her libido, her desire to copulate, to have sex with her husband, also begins to drop. So when you have a combination of these many factors coming together,
Yes, exactly.
you see that fertility is compromised in a way.
Wow.
Yeah.
So I can actually relate with what Dr. Samuelson just said. It can actually this also explains why some women give birth to their first child at 25. And then the next thing, maybe when they are not ready for conception, let me even say 30 years, the next thing, say they are struggling with fertility. So it means that as a woman ages, yes, 30 years is still young, but we've seen some people that even in their early 30s, they've come to check themselves and they'll tell them there's premature ovarian failure.
Yeah.
But then this was somebody that gave birth maybe like 5, 7 years ago. Maybe she felt she wanted to pursue career. At least she has
Yeah.
one to hold. And then the next thing, she's dealing with issues about
Yeah.
ovarian
Yeah.
failure and all of that. So this can actually go a long way to let us know that age, you never can tell when your own menopause will hit. Because it's just like now we have some people that went into menopause at 30 and you just wonder, how
Yeah,
is
it
happening
happens
so how is happening so
early.
fast, yes, so early. Well, these are for the fertility challenge. What are possible challenges that you could have with advanced age women in the course of pregnancy, like when they are pregnant? What are some of the things that you people experience with these women that people say
Yes.
elderly pregnant, elderly
Yes.
priming?
So um um like I was saying,
Yeah.
even if, for example, if a woman is, advancing in age and she gets pregnant,
Yeah.
she's predisposed to some other things. For example, she could be predisposed to miscarriages. There's an increased chances of miscarriages
Happening.
in older age women, really because of, like I was saying, the quality of the eggs is compromised or is
Yeah, I
not as good as
see.
it is. So the quality of the embryo that is formed becomes a problem. Okay, and
Yeah.
because of that, the body knows how to detect a baby that will not be a good baby and flushes out the baby. Yeah, so the
See.
body has that kind of mechanism. So when the body detects that, okay, the baby that is being formed is not going to be a very good baby, maybe may have one or two syndromes and all that,
No,
the
yeah.
body tries to eject the baby.
Out.
So those kind of people are at risk of having more than normal. They are also prone to having diseases in pregnancy, medical disorders in pregnancy, like
Oh,
hypertension in
okay.
pregnancy. Even though she may not be hypertensive before she got pregnant, she can
Yeah.
develop hypertension while pregnant. She can develop things like diabetes while pregnant. Okay, those people are also at risk of having babies that are not normal, as it were. Maybe babies like with
Congenital
congenital anomalies like Down syndrome, and all
and
those
all that.
aneuploidies
Yeah.
and the rest. Those women are also at risk of having operative deliveries, cesarean section,
Section.
and the rest. Yeah. So those are some of the problems we encounter with those women, and
Women.
things like, also, in fact, just today I saw a patient that is 35, almost 36. She's pregnant and she's coming with a fibroid in pregnancy
Wow.
with a complication. She's having significant pain in pregnancy because of the degeneration of the fibroid. So these are some
Fibroid. Things
of the
that
things that we
peculiar
could
with
have
that.
in
Wow.
that age group.
So viewers, we're taking note of these. As much as yes, we want to go get this money, as much as we want to follow after things that we want to achieve in life, it's still best that you achieve conception when you're much younger. But however, thank God for technology that has also made it a bit better for women that are advanced in age to be able to access some of this care and help them see through to conception, pregnancy, and even up to the point of delivery. So, well, for women that are advanced in age that are considering conception, are there some assessments that you give? Do you just for them, for those, maybe some of them even get to the point of IVF, but even before that, is there any basic investigation that you would advise a woman that is in her maybe advanced age, like you mentioned, over 35, and she's considering for her fertility options? What are possible assessment that you make for her and possible recommendations?
Yeah, so maybe talking about what kind of tests they can do. I've seen women come to my clinic and they ask me what kind of tests can they do to know if they can conceive. You understand? Because for whatever reasons, well, generally we do. If the patient has not is not complaining of infertility, the assessment is a bit milder than if the patient comes, she has been trying to conceive and she cannot conceive. That we do what we call an infertility workup for those kind of patients, which takes is a lot of investigations that you can do. But for people that just want to know their chances of conceiving,
Yeah.
we can do basic checks, like ultrasound scan.
Okay.
You understand? In ultrasound scan, we can do things like what you call antral follicular count, also just to look at the ovary, see if you can visually see the eggs in the
Yeah.
ovary and count them and see if they are okay. You understand?
Number.
You can do blood tests to check their hormone levels to make sure that their hormone levels are within normal range and they're not too high. Because if they are too high, they begin to tell you that the woman's ovarian reserve, the egg she has, is really small,
Declining.
and she may be getting to menopause, right? So the blood level, the hormonal tests also help. You can also do things like AMH.
Okay.
AMH is also a very good one that we can do. It tells you about the quantity, right, of the eggs. So those are some of the basic scans that we can do.
So for instance, should it be that we have an advanced age woman married for let's say 6 months, and then she said they've been trying, maybe they've been trying, and then they don't know why pregnancy is not happening. What would be your possible recommendations when she visits, like, okay, way forward for her, maybe after your investigations, and maybe you are seeing the poor ovarian reserve, or even if she says her tubes are patent and then your hormonals says something else different, maybe they say one tube is patent and your hormonals is looking like our ovarian reserve is declined, and maybe just maybe her husband's sperm is moderately okay. Well, you're already having some commas in such a woman. What would be your counsel for her? Should she still keep trying?
Keep hope alive.
Oh, yeah. Yeah, so what would be your
But
counsel
you
to such
raised
a
an
woman?
important point. And the point you raised, I would like to highlight, and before I answer your question, is that infertility is a couple's problem. It's not a woman's problem. It's a couple's problem.
Yeah.
The science tells us that when you say woman with infertility, 30% of the time the fault is with the woman, 30% of the time the fault is with the man, 30% of the time is both of them that have a problem.
Oh,
Then
see.
10% of the time is unexplained. It's unexplained infertility. You cannot tell why. So it's important to have that also at the back of your mind, that when we are investigating for infertility, we investigate the couple, not just the woman. An important point I think should be made.
Yeah.
But to answer your question, if a woman, say in her 20s, 24, 25, comes to me that she has been she's married, because I've seen that she's 3 months married, she's trying to get pregnant, and she has not gotten pregnant, I tell them, go and try for 1 year. Except there's something obvious. Maybe she has PCOS or something. If there's something obvious, then we investigate. But normally, for younger women, we say try for a year. If
There's
you don't,
women less than 35.
yes, less than 35, maybe in her 20s.
Okay.
We say, okay, do it for a year and see if you conceive. But if a woman is 35 and above, right, and she comes to me maybe between 35 and 40, and she comes to me that she's not been able to conceive, she's been trying for 6 months, that warrants an investigation. And it warrants an investigation because you know that this woman is running out of time. I put that in quote with respect to all women.
Fertility,
Yeah, she's running out of time. So you need to investigate her, to know her and her husband, to know where the problem could be. And you know, there are different causes of infertility. And so where you find a problem, then you fix the problem, right? And, you know, basically someone once said to me that God has solved the problem of infertility by giving us technology. So there's almost, maybe very few, but there's almost no problem a woman will have or a couple will have in terms to infertility that medical science does not have some sort of a solution for. It may not be 100%, but we can attempt something, right? So that's the beauty of science. So really, treating infertility depends on the problem, on the cause of the infertility. I don't know if I've answered your question.
I was saying that, for instance, if she says that, if for instance you could do your investigation and it shows already that her ovarian reserve is really low, really low, and she has tried for 6 months, what would you recommend? Would you recommend that, okay, she tries an IUI or she moves forward to IVF? Because if it's with respect to IVF, if she's hell bent on using her eggs, or I mean, just what would be your recommendation to such a woman if her husband's sperm doesn't seem to be in excellent conditions that you can afford to keep trying? Yes, what would be your
well, in those kind of category, because you have painted a specific category of patient, you've presented painted a picture of a patient who is in advanced maternal age, and I am assuming she's still seeing her menses.
Meaning, they said her tubes are patent, but pregnancy is not happening.
So that her tubes are open, pregnancy is not happening. You investigate her, and you find that the possible problem could be that the quantity of eggs she has is reduced. So that's what we call a low ovarian reserve. Low ovarian reserve on its own is an indication for IVF. Okay, so such kind of women need to be counseled. They need to be counseled because she has two options really. And the two options she has is that she needs to do an IVF. So we can actually do an IVF with her eggs, or we can use donor eggs. Someone donates eggs for her, right? The problem is that the older you get, the quality of eggs reduces. So the possibility of achieving fertilization and consequent pregnancy with her eggs may be low. You understand? And that's why so you counsel her on both ways. And really because we want her to get pregnant, we would counsel towards using donor eggs, because we get donor eggs from much younger women, teenagers in their early 20s, people that their egg quality is still good. So those ones have a higher chance of achieving pregnancy if we use donor eggs. So you really counsel her on both ways.
Allow her to make her decision. It's up to her.
There's what we call autonomous medicine. The patient has the right to make the decision they want to make.
Okay, so viewers, hope we're also noting that, yes, as far as, and you know, sometimes a woman just feel like their tubes are open, so pregnancy should happen. But sometimes you can still have patent tubes and then pregnancy is not happening. And if, for instance, you've stayed 6 months, over 35, pregnancy is not happening, no matter how your tubes are open from now to tomorrow, and you have tried, and it's obvious, maybe you've also checked your husband's sperm, ideally, pregnancy might still be able to, even though maybe there are some little conditions. It might just be a way, the doctor, I'm sure, will evaluate you. You know, they will give you the simplest of options. They'll give you the extremes and then allow you to make your decision. They can decide, okay, if you say no, let's try ovulation induction. Of course, they will, because it's your decision. They can try that. If you say, okay, I don't want to do IVF, IVF seems to me like extreme. They can say, okay, we can try IUI if they say your tubes are patent. And if pregnancy does not happen, of course, you will end up at the point of IVF. And then get to the point of you have the women sometimes that can have this attachment with their eggs that is so difficult to come to terms with accepting donor eggs. So in such a case, if you insist on trying, they can still allow you. Of course, no matter how we feel this is best for you, you have to make that decision yourself as a woman. And that's why we're having this session today. So we counsel women appropriately. You really do not have to allow yourself to get old before you start considering conception. Of course, Should it be that you have other things, please visit us at Alps Hospital or a fertility center if you feel you Alps is not accessible to where you are. But I know Alps is accessible to anyone in the world. So Alps Hospital is accessible to anyone in the world. So you can actually freeze your eggs and then save yourself the fear of dealing with poor quality egg or poor quality children. I mean, if you are 20 and you freeze your egg, if later in life you want to get pregnant, it's just that you plan that it's IVF that will
Yeah.
be the way for you. Except maybe you try. If you try and it's not happening, then you fall back to your eggs. Better quality children. I mean, the younger you are, the better. Very likely that your offspring would actually, the quality of offspring, like Dr. Samuelson mentioned to us. So so with respect to maternal age, what's your counsel generally to the populace with respect to advanced maternal age, their fertility concerns? What's just your counsel to women out there? Because I'm sure we have women over 35 that are watching, right? There's some of them might not even be married and they are watching, just wondering what can be done at this age. I mean, just what's your counsel generally to women with respect to advanced maternal age and all that comes with it?
Well, um, my counsel would be, you should, if you are married and you are trying to conceive, and it's not working, please see a doctor, see a gynecologist, so that they can assess you and they can know what they can assess you and your husband. They can know what the problem is, where the problem is, and give you the right treatment so that you can conceive. Right? If you are single and not yet married, um, get married quickly and try your best. Yeah, but then again, that's on the lighter side. Then again, is that there's no situation that is hopeless. Even if the getting married is being delayed, you can come. We can be assessed. We can freeze your eggs, right? We can take your eggs and we can freeze them, pending when you get a partner and you're ready to conceive. I mean, this is even better for people that are younger. The younger you are, better. The younger you are, rather, and the more maybe a partner is delaying, and you still have the desire of conceiving and having your own children, you can visit a fertility doctor. We can harvest your eggs and store them for you. You understand? So that whenever you are ready, I mean, you can still have your babies. So my point is that no situation is hopeless, right? No situation is hopeless. Whichever end of the spectrum you may find yourself in. In fact, we've even had women that are menopausal that conceive and have their children with technology, IVF, and the rest.
Yes.
So all hope is not lost, regardless of which where you are in
Age
the
bracket.
spectrum of age. You can still have your own baby.
Babies.
You understand? So when time comes, you can visit a fertility doctor. Alps Hospital is always open to see any kind of patient, and we can give you a solution by the grace of God.
So we have some questions coming up. We
Yeah.
have a question from a woman. She said, for women who naturally have not been able to have children since they got married, and they are now in their 40s, what options are there for them? That's the
Okay.
question.
So, like I've said earlier, you need to
Yeah.
see a doctor first of all. The first thing you need to do is to see a doctor, see a gynecologist, see a fertility specialist who will assess you to know what the problem is and where the problem is.
Yeah.
Assess you and your husband, and then they know what to tell you. But the options are mirrored. You understand? For example, you're in your 40s, you've not been able to conceive. You can have an IVF with a donor egg if you're menopausal. We can try using your eggs, even though above 40, the quality or the chances are quite little. So once you're 40 and above, most fertility doctors will counsel you to use donor eggs.
Yeah.
And of course, again, we need to check your husband also. So if your husband's sperm is fine, you can use donor eggs with your husband's sperm.
Yeah.
And you have a
Increase your
child
chance.
that it has your husband's DNA
Yeah.
with,
Yeah.
and you can also have, if your husband's sperm is not good, you can also have IVF with donor eggs and donor sperm, and you can carry the baby if you want to.
Yes.
You understand? Carrying that baby also gives you the ability to bond
Yes,
with the
baby.
baby, you know,
Yes.
and let the baby be yours, as it were.
Yes.
And of course, there are also options of surrogacy. Also, you can use you can use a donor egg, donor sperm, surrogate. I mean,
And
the
all
options
that.
are
Yes.
myriad.
So hope this answers your question. This is coming from one of our viewers on Instagram. I think okay, her name well Halos. I think she said Halos for women. Yeah. So I hope this answers your question. Like he has mentioned, options that are available to you at this age. Of course, you've been trying for so long. So if you've been trying when you're younger and pregnancy is not happening, the way forward might just be IVF with donor egg. And should it be that you're not just open to it, yes, ovarian rejuvenation might just be an option, but ovarian rejuvenation also does not say that it's automatic your eggs will
Yeah.
just be revived, but it might just be an option for someone that is not open
Mm.
to egg donation. So well, I think that if you still would want further counsel, you can book an online consultation. We respect the number is being displayed on the screen, so you could communicate with any of our gynecologists like Dr. Samuelson and the rest of them. You'd have proper consultation and then plan the way forward just to be able to achieve your fertility dream. Whichever way might be the option for you, it's good that you have an open mind to accept the options, because the goal is for you to have children that you can call your own, whichever means, no matter the means that it might be with respect to IVF. It's still for you to have the one that you call your own. There's nothing like when you say this baby is my own, nobody's coming to contend the baby with you. So we hope that somehow soon and very, very soon, yeah, we hope you're able to achieve your fertility dreams very, very soon. Thank you so much for that question. And yes, thank you so much, Dr. Samuelson.
My pleasure.
We had a very good time with you today. And with respect to maternal age, for any reason, as a young lady, should it be that you have plans of, I even think that young ladies, before we get to this point of advanced maternal age, from when you are young, just check yourself and be sure that you have hope, because we've seen young ladies that have gotten into menopause. So it's good that you check from when you are young so you can know what the future holds. Because if from now they are telling you, at this age 25, your ovarian reserve is looking somehow, it means that even if a man is not coming, you should just by all means look for a way to preserve your eggs, just to avoid some of the issues that could actually crop up from this whole advanced maternal age issues. But this is not to scare women, whichever age range, like Dr. Samuelson has said, whichever age range you might fall into, there's just a way out. It's just for you to get the right counsel and then plan the way forward from there. Thank you, viewers, for staying tuned. Thank you once again, Dr. Samuelson. We had a good time with
Thank
you.
you. Thank you.
So we look forward to seeing more of you. Please always stay tuned. Look out for our videos, educative pictures and memes, wherever they are, maybe. Please just look out for them so you're able to grab one or two for the moments when it's posted. We look forward to seeing more of you in our next session. But for now, we hope that you enjoy the rest of your evening. Bye.